What's your name again?
Allison.
Alison. What are you
And
doing
Angel,
here?
right?
Yes.
I'm a nurse practitioner,
Oh, a nurse
and I
practitioner.
came up to because I really like what this clinic is doing. So I came up
What is
just
doing?
to providing low-cost health care without dealing with insurance companies.
So you're going to be a nurse over here?
No, I'm going to stay where I am in Bisbee, but I want to see if I can just bring what they're doing here
Over there.
to Bisbee. Yeah.
I see.
How are you?
This is a cool spot. These are all of our current volunteers, clinicians who are here, staff that are running the show.
Well, you have a lot of people.
A lot of people come through. Yeah, we touch a lot of lives and they touch ours. This is Allison. She's a nurse practitioner from Arizona who's looking at starting something along this line. Cool. So we're just hanging out with her today. So we have about 50 some study students. But these guys save the patients probably $200,000 a year in staffing costs that we don't charge. So we looked at our price. If we didn't have them here, we'd probably be more at $70 to $80 a visit, honestly. To
And it's 40 now.
And it's 40 now.
And you started out at 25.
We started at 25. We held that for like 3 or 4 years. And the other thing is, as volunteers, they do everything. They don't just file charts. They do all of the intake, vital signs, callbacks, normals, abnormals. I mean, we feed them information to share with the patient, and then they do all the callbacks for us. They communicate with scheduled patients. They do everything. So really, they take money, they take payment, they draw labs, they do finger sticks for sugar and for hemoglobin. So they're really like full-on medical assistants, and we give them that training. It takes about 3 months for them to get up to speed, really 6 months total, and then we get another 6 months. We make a 1-year commitment minimum.
But mostly I do like attaching and for medical records, sending out medical records requests, and just like a Swiss Army knife, like Andrew said. And
We have a bunch of Swiss Army knives here.
Yes. And it works well.
Corkscrew.
It's just a cool place, and the model was. I just never thought I'd find this model, and it was what I wanted to create. This model is very much like what I was like. I want to manage a center that looks like this, and I was like, I could go to grad school and sort of learn someone else's model that's not like this at all, sort of conventional, or I could just do this work and really learn it myself, and but it was exactly like, it was almost exactly my vision was this, and that's how I ended up here, was because I was like, wow, I could just do this work and be this person.
So this is going to be our wall of success, where we take the time to really highlight patients who have done amazingly well with their diabetes or drug addiction or something. And we get to highlight what they did on their own, the piece that we contributed, some pictures of them and their family, what they care about, and make it more like a poster size that we can take down, put up again a few months later, and kind of rotate around.
I've lived in the South Valley my entire life, and I had no idea that this little clinic existed. And I walk in and I realize that it's like, I see all these essences, flower essences, and it was just very strange. And I saw Dr. Andrew, and then I became a patient for a little while, and then I just started manifesting that I was going to work here when I got better, and I started working here.
And is it successful? Do you teach?
I feel only because of what other people have told me is that this is the most successful, because usually they give you the Suboxone and send you on your way, and they might tell you that you have to go to counseling, they might not. We do not require counseling. We really push it, but we don't require it. But the healing circles are what no one else has.
Is this the only needle exchange program in Albuquerque?
No, no. There's a bunch. It's a pretty actually healthy and thriving effort that's been here. It's started long before we started, but we're one of the few places that's like consistent in this part of the neighborhood, in this part of the city, where it's also a clinic, and people sort of come in and they get a sense of I can access a clinic kind of services. Most of the other ones are outreach in vans, homeless sites, things like that. So. And people, they sort of pick the place they like to go to, and then they go consistently to the same spot. These are creatures of habit.
We start off by talking to see how everybody is doing because they got their Suboxone last Wednesday. And so that means that between then and now, they will have been off of the heroin or opiates. Because before that, they were still probably using up until that day that they got the Suboxone. So it's a big change between last week and this week in the way that they feel. And we check in with them. We do some readings that one of the woman that heads the program, Paula, and I have found from spiritual teachers that we know. And then we start the healing circle, which encompasses acupuncture in the ear. And there's 5 needles, and the specialist will explain exactly what each needle pertains to. And then we lay everybody down, and we give them a Reiki treatment.
This is beautiful.
This is flower essence medication. People who don't want medications, drugs, who have what I call stuck emotion.
Right.
So if they have anger, jealousy, fear, this stuff works really well for those kinds of emotions that are just stuck in the limbic system, and you want to help that person move it out. Of course, it's a counseling technique. You sit with the person, you say, what are you struggling with right now? You just help them get to their own sense of like anger. It really is anger. Well, there's 12 flavors of anger, so let's get into anger a little bit, figure out what flavor of anger you have, and you go into a book. Basically, people like to be exposed. When they're sick, they're like, help me see myself. So you help them see themselves through this book. There's English and Spanish, and then by the time they've gotten to the point where they really see themselves and they've agreed that, hey, this is where I'm stuck right now, and you're giving them a medication that they're putting as drops under the tongue, and so you've taken them to the point of consciousness where they understand what they're stuck on. You're giving them a tool, a technique that they can use to move past it. So the sort of argument of placebo versus chemical doesn't really matter at that point, because you're giving them a process by which they are consciously starting to shift their own brain around that issue. And you can have pretty good results. I wouldn't use this stuff for broken arms. We collect the money for the labs, and so the lab gives us a better price because they don't have to worry about any collection practice whatsoever. We remove that from their worry. So they send us the bill, we pay whether the patients pay or not. So we pad the bills appropriately to about 10%, and we lose about 10% of people that don't pay. So for a lipid panel, a CBC, and a CMP, pretty standard routine labs for people, that's $44. It's really, really good. And people love it. And they know, most patients coming here have been jacked by the system already. They know that that's a $300 bill. Each clinician gets sort of their spot that they get to call home. We keep this one as a non-focused clinician room, meaning that it's sort of like our overflow procedure room. Any clinician can step in here if you need to give IV fluids or do a procedure, EKG, ear lavages. And this is sort of like our extra room, if you will. And we have 2 main focuses. One is on medical debt, and we have a really strong presence on that. And then the folks running the medical debt also do the political work. They do the political arm of the clinic, where they're really looking at the public hospital, at the public monies expended on healthcare, and kind of trying to shape and guide a little bit of that process so that it's intelligent and well done and fair, all that kind of stuff. So giving up a voice to the folks we serve. It's a little exercising Gandhiism.
So when you started out, what were you doing? You started out in like a 2-bedroom house, which is
house,
what I'm looking at.
Yeah,
in
just
Bisbee.
doing basic clinical care, and we added in the drug addiction piece with a contract from the state for harm reduction needle exchange. And it was sort of the most straightforward thing that we could add in right away. And then we figured we were taking care of diabetes as best we could on an individual level, which is not bad, but it's not like optimal either. You want to add family level in if you can. Now in the individual visits, you can, and we're starting to get there now, where we start to try to get the whole family to come to the visit. Because at the very least, then you're doing a bigger conversation about who's cooking the food, and how the whole family is basically pre-diabetic if one person is diabetic. And it's individual represents the disease, but it's really a cultural and familial disease. So we're starting to shift that into the individual visits as well. But then the programmatic stuff is cool because it's classes, it's education stuff, it's that wall we talked about where we're going to build a nutrition focus, which of course has a lot to do with diabetes. Another project that we have here through a nutrition student that comes to us as a work-study student is some gardening and farming stuff. Low scale. I mean, it's not a huge volume of stuff at all, But it's more the symbol of it, and for us, the beauty of it, and the plants. Having plants around is really nice.
I think the nicest thing is the light, the way the light comes in.
Yeah, the builders were really skilled at what they did, modulars we use locally. And they put a lot of light in for us, a lot of windows. This adds a nice culture for the staff themselves, where we can sit down and actually have little conversations together and do some bonding. So it's not just all running and working and running and working. Really nice space. So this is, our one sort of community room, if you will, and we do our drug addiction group circles in here. Also diabetes classes are done in here. Our acupuncture is going to set up community acupuncture where you can come in for a lower price point and get 20 minutes of relaxation acupuncture. I'm not so much focused on disease, but on just stress in general. And then we have an altar space. And we have a very clear distinction in this clinic about the difference between spirituality and religion. We don't bring religion in because it's too powerfully symbolic of people's judgments and ideas and some kind of sense of ownership over what this idea of life is about. But spirituality is something that we all partake in. So that is a non-religious, spiritual sort of representation that I think most people can get into. They can sort of see themselves up there, find themselves there. So twice a month we start people on opiate addiction treatment, and the filter, the entry, the welcome is through traditional medicine first. And they get 4 sessions over a period of 2 weeks in a group setting. That includes everything from meditation, reiki, mindfulness, communication, deep breathing, some yoga, acupuncture. That really kind of rehumanizes them in their relationship to the recovery process and to the people trying to help them in their recovery process, so that we're not an institution in their mind. We are a group of people who are real, and they are real. We took the time, we spent a little extra money on stuff. We didn't go cheap on really anything. I mean, buy something cheap, you have to buy it again the next year. So we've learned the lesson of poverty, if you will. If you have only so much money, spend more.
Is that the lesson?
That is the lesson.
If you have
Yes.
only so much money, spend more. So you only have to do it once.
You only have to do it once. And that's the same thing with referring patients to specialists. Like if you can take the time to figure out what a patient needs for real, and you send them to a type of therapy that costs $80, it seems like a lot of money up front, but it gets the job done. They're not running in a circle for 3 years, spending way more money on lower cost therapies. So we really have embraced that philosophy. Like, I don't care if it's a $400 MRI study and that person needs it, then they get it. But we're trying to be really thoughtful about ordering the right test, basically, and getting them to the right specialist. And I think we hit that mark at least 90% of the time.
So I'll be putting 5 needles in each ear, and they're very fine needles. They're single-use only needles, and you'll feel a little poke. Have you had acupuncture before?
Yes.
Okay, so you'll understand that. So if you'll breathe in and breathe out, and breathe in and out. Okay, you're standing too far away. All right, there we go. Right here, the needle's going in. And the first one is sympathetic nervous system. The second one is Shannon. That's the heart. The third point is your kidney point. Fourth point is your liver point.
This is just to help with the detox.
Reduce anxiety, cravings. The last point is the lung point. The lung point helps with grieving, sadness.
Really? I felt the lung point, but I'm an ex-smoker.
In here.
Hold on, let me take it.
Oh, what was that? That's tender.
That's your sympathetic.
Fight or flight.
That's your central nervous system. Yeah. That's your kidney point. Liver point. And then your lung point. Okay. How does that feel? Anything bothering?
Tingly?
Tingly?
It's good.